Johnson Johnson COVID vaccine. Millions of doses are rolling out as experts warn against a new surge. Dr. Jen Caudle is here to help us unpack all the latest COVID news. She is a family physician and associate professor at Rowan University. Dr. Caudle, thanks so much for being here. So Johnson Johnson is releasing 4 million new vaccines out there. First of all, where do we stand when it comes to vaccinations across the country, especially in the Black community?
So the good thing is that the Biden-Harris administration has certainly increased the number of vaccines that have been given, period. It almost seems like almost every day there are more and more vaccines given than the day before, which is a good thing. But when it comes to African Americans are not getting the vaccine as much as our white counterparts. That is a problem. And that is something that has to change. The vaccine has to reach all communities, neighborhoods, churches, community centers, everyone, and everyone needs to have access to this vaccine. It's very important.
So, Dr. Jen, I get in so many arguments with my friends. I stopped doing that when it came to this vaccine, but I'm so passionate, right? We want them to get vaccinated. But it is true that the trust has to be earned with Black and brown communities. Right. Do you feel like enough is being done to earn the trust so more of us go out and get vaccinated?
I always think more can be done. Certainly the atrocities that have happened with our community, the African American community, over the years, and honestly still now, we know that systemic and institutionalized racism still exists, right? It's not over, it's not gone, and it still also exists in the healthcare system. That has to be acknowledged by people outside of us. That is, the healthcare system has to acknowledge that and has to work to rebuild our trust. At the same time, it's important for us, just as every American, to understand the data behind these vaccines, that they have been studied in tens of thousands of people, that they have been deemed safe and effective, and that getting the vaccine, COVID vaccine, is one of the most important things we can do to stem the tide of this COVID pandemic. It's crucial.
All right, Dr. Jen, so the numbers are starting to go down, so we can remain a little optimistic about that. The vaccines are going out. We see movie theaters. We're seeing restaurants starting to open again. We're able to go into the nail salon so Sharon can get her hair done and her nails done and all that type of stuff so everybody can look beautiful again. But how do we remain optimistic and live our lives while still being careful out there?
I think that's the name of the game. And in fact, last week, actually, we saw more of a plateauing in the decrease in sort of numbers than we had before. So I actually think that, I'm starting to feel optimistic, honestly, for the first time in a year. But I think we actually have to still be cautious, not that we need to be pessimistic. But these numbers can plateau or go back up in a drop of a hat, in a moment's notice. So, it doesn't give me pause that things are opening up a little bit, but what gives me pause is this idea that we might become complacent, and we can't do that, which is exactly what you're speaking to. We have to still wear our masks. We still have to avoid being with people that are not already in our bubble. We've got to social distance, wash our hands. And honestly, even though I've been vaccinated with both doses of the vaccine, I'm still doing all those things. My behavior has not changed.
And if you could, Dr. Jen, really, you're the doctor. So tell us about, can it really help lessen the blow if you still get it? We saw that the DC mayor lost her sister, not even 65 years old, from COVID. And it just makes people say, hey, you got the vaccines rolling out. Some people only got one dose. Some people are on their second dose, and so many yet to come. But can it help lessen the severity, lessen death?
Well, that's exactly what these vaccines do, which is what's so exciting about them. One of the things we know, this is the Moderna, the Pfizer, and even now the J&J vaccine, they overwhelmingly decrease severe illness from COVID. What I mean by that is that if you were to get COVID, the likelihood is that you wouldn't die from COVID, that you wouldn't end up in the hospital on a ventilator from COVID. And honestly, that's the main thing. It's not the only thing we care about, but that's one of the big things we care about. If you were to get COVID but only get a stuffy nose, well, it's not to say we wouldn't care, but we would care a lot less. The fear in this disease is that some people don't just get a stuffy nose, they end up on a ventilator, they end up in the hospital, or they die from it. So these vaccines actually prevent severe illness and in many cases death from COVID-19. That is remarkable. That's one of the reasons why I and my colleagues and we as a nation are so excited about these vaccines. There's also some data with the J&J vaccine that's just been approved that may be able to decrease asymptomatic transmission, which is a very exciting concept and possibility. Of course, we need more data, but that's the key here. That's why people should want to get this vaccine, is because these vaccines basically help you keep you from dying from it, getting so severely ill that you end up in a hospital. And that's the tragedy in this disease, one of them certainly.
Of course, I think we're going to show a live look of the rollout for the Johnson & Johnson vaccine going out today. Once again, 4 million doses are going out here. But we got 3 different vaccines now. We got Johnson & Johnson, Moderna, we got Pfizer's, but we also have different efficacy rates as well. So if I'm about to take the vaccine, is there one that's better than the other? Can I request to have one? How do I know what's best for me? Which one is best for me?
Yeah, that's a really, really great question. Well, right now, because we don't have enough vaccines for everyone, we're still trying to get vaccines from wherever we can get them from. There's not a choice because there's not enough to have a choice, among other reasons. And what we say is that take the vaccine that you're able to get. Now, in terms of the efficacy rates, meaning how effective it is, I know a number of people are concerned about this. I get messages on my social media every single day saying, I'm worried about the J&J vaccine. Is it efficacious? I hear the numbers are lower. So we do know that it's got a 66% effectiveness rate against moderate to severe illness, about 85% against severe illness. That is a little bit lower than Moderna and Pfizer, which is about 95%. However, Moderna and Pfizer and J&J, those two groups cannot be compared. They were tested and trialed in completely different times. One of the things we know about J&J is that it's actually been tested against variants, which is something that Moderna and Pfizer were not. My point being is we consider all of these vaccines to be roughly equally as effective when it comes down to the brass tacks, which is, will the vaccine prevent severe illness and death? And they all do that remarkably well. So when it comes down to it, I've had patients, I'll be in the office later on this morning seeing patients. I've had patients say, I want to wait for the J&J one. Guys, don't wait for anything. Get what you can as soon as you can. This is not the time to pick and choose. Number one, there's not much room for choice. We don't have that many vaccines. What's important is that everyone get vaccinated as soon as possible. That's what's going to get us back to more normalcy.
Hey, Dr. Jen, we only have a few seconds left. I've got a 9-year-old. For people who say, what about studying it on kids, or should we enter our child into a trial? What do you say?
Well, honestly, as a physician, I'm a fan of clinical trials. I have friends and colleagues, doctor friends, non-doctor friends who are pregnant, who've gotten the vaccine, who've been in the trials. I know some children who actually wanted to be a part of the trials. They're excited about this. They're excited about the chance to be able to participate in science and to be able to hopefully give information that will help probably one of our generation's biggest tragedies, right, which is COVID-19. Trials are done with a large number of safeguards in them. The only way that we'll know that these vaccines are safe and effective for children is if children are enrolled in them. Now, I understand that not everybody may choose to do that. That's okay. But, am I a fan and am I a proponent of clinical trials? Absolutely. I would also say the more diversity that we have in trials, the better. One of the problems is that in clinical trials in general, and this is aside from the child issue, in clinical trials, we don't often have a lot of African Americans or enough, say, people of different ages, from different places, different walks of life. We need that to really know how medicines, drugs, vaccines affect all of us. So I would say that's an important thing.
Wow. Well, appreciate you so much, Dr. Jen. We'll be checking in with you a lot as this pandemic rolls on. Thanks so much.
Absolutely.